Thank you, Tessie. Thank you for joining us for the September 8th.
This conference will now be recorded.
Thank you for joining us for the September 8th Respiratory Care Advisory Council. At this time, we will take attendance. Dr. Takarala? Dr. Warren? Amy Rodenhausen?
Here.
Sandra Keller? Karen May?
Here.
Robert Pelfrey?
Here.
And Cindy Groener. I see Cindy. Meeting minutes from the June 9th, 2020 meeting were included in the materials that we sent you on Friday. Can I have a motion to approve the minutes from the June 9th, 2020 meeting?
I motion to approve them.
Second, Dr. Pepper.
Chelsea Wansky, and I don't know if you guys can see her on there. She is our new legislative director, and she replaced Jonathan Laplace. And we are extremely excited to have her on our team. She brings a wealth of knowledge when it comes to state government and in legislative activities. So we're really happy to have her. And we are hoping that she will give us a legislative update. So Chelsea, do you want to give us a short legislative update?
Yes, I don't. Can everyone see me? I think I can see myself, but I was having issues earlier, so I don't know if it's coming through. If not, I hope you can hear me.
We can see and hear you.
Oh, perfect. Great. Well, good afternoon, and thank you for allowing me the opportunity to provide the legislative update. I'll go through some legislation that we are especially concerned with or has seen activity since we last met. And last week was very busy in terms of legislative activity. So first, Senate Bill 246. This is the Occupational Licensing Reciprocity Bill. At the last meeting, at the last board meeting, I should say, I had advised that the Legislative Affairs team had been meeting with the bill sponsors to request some changes that would allow the board to retain our ability to vet out-of-state applicants at the same standard as in-state applicants. I'm happy to report that the sponsors were receptive to our requests, and many of those requests were granted. There are some issues that we're still concerned with, and while we're grateful that the sponsors were willing to work with us, we have some things around the 5-year look-back limitation, which would only allow us to look back 5 years prior to the date of application into an applicant's background. So we will continue to advocate for a longer look-back period, ideally, an unlimited look-back, and I'll keep everyone updated on the progress of that. The bill passed out of, I'm sorry, the bill has not passed out of the committee yet. So we do have a little bit of time to work with that. It's still in the Senate. And so I'm confident that we can get a better working agreement with the sponsors to get that language changed. House Bill 203, which impacts mobile dental services, passed out of the legislature last week and is awaiting signature by the governor. The final bill was actually amended to include language from Senate Bill 303 around pharmacy consult agreements. The amendment includes, it gives pharmacists or authorizes pharmacists the ability to enter into consult agreements with certain advanced practice nurses and physician assistants for the management of patient drug therapies. Additionally, it allows pharmacists to order and evaluate laboratory and diagnostic tests for patients rather than limiting it to just blood and urine tests as under current law. That bill, actually the amendments that were added regarding the consult agreements, it was added in the end of committee and went to the floor, straight to the floor for a vote. So there was not a lot of discussion around adding that language, and so we're working through all of that currently. House Bill 263 is another occupational licensing bill that we are monitoring very closely. This language would require that the board provide a comprehensive list of criminal offenses that would prevent a person from becoming licensed in Ohio. The problem here is that the board may only consider the listed offenses when making a determination on an applicant who has had a prior criminal conviction. Additionally, the board is only granted the ability to look back 5 years for the background check. When the bill was in the Senate, the medical board worked with a consortium of state healthcare boards to put together a package of amendments which were presented to the sponsors. Unfortunately, very few of those amendments were included in the House passed version of bill. The medical board, along with those healthcare boards, Ohio healthcare boards and commissions, will continue to work together to try and improve that language as it moves its way through the Senate. House Bill 341 also passed out of the legislature last week, and it authorizes a pharmacist to administer any long-acting extended-release drug prescribed to treat drug addiction. An amendment was added to authorize certain advanced practice registered nurses and physician assistants to develop protocols to permit individuals and employees of service entities to personally furnish or administer naloxone. This bill has also been delivered to the governor and is awaiting signature. House Bill 492 expands the ability of physician assistants to perform procedural sedation for the purpose of rapid intubation. The language would update also physician supervising agreement to collaborative agreement, which the PAs believe better represents the relationship between the physician and the PA. There are some concerns regarding this bill around scope of practice, and so we are in the process of meeting with board members and stakeholders to address those concerns. House Bill 606 passed out of the legislature. This bill provides civil immunity for healthcare and emergency services provided during a government-declared disaster or emergency for exposure or transmission or contraction of certain coronaviruses. The final bill included language to extend the protections through September 2021 and has been delivered to the governor. Finally, we continue our work on House Bill 679 regarding telehealth. Our legal team has drafted amendments and is addressing the concerns around initial visits, consistency and standard of care, medical board rulemaking authority, and synchronous technology based on the discussions of the ad hoc committee. Those amendments are scheduled for review at the next committee meeting tomorrow. That concludes the legislative update, and I'm happy to take any questions.
Thank you, Chelsea.
No, I got off the easy.
I want to say on the record too that Dr. Warren and Sonja Keller also joined us. We have a couple of rules that are up for discussion. One is a rule that is going to be effective on September 30th, and one that is getting ready to have a hearing, and Sierra is going to address that for us.
Yes. So the two rules becoming effective at the end of this month, those are 4761-6-01 and 4761-7-04. So any of you who were on the council in 2019 may have seen these. These are the competency form and education verification forms that the board receives from L1 permit holders. Basically what's going to happen at the end of this month is we are putting out a new form for education verification. I did send that to you in your materials, so hopefully you'll probably seen those or may have provided feedback. I know Sonja, I don't know if she was able to hop on. Oh yeah, okay. Hi. I know you had provided some feedback on these back last time the rules were considered. So that education verification form is in its final version, but we are still working through the new competency verification form, which is what I know previously it was a very long list that the education providers would then have to give to the board for approval every time an L1 permit holder completed a competency. So we are kind of trying to streamline that process so it's only going to be between the educational provider, the student, and then the employer. So they'll handle all of that, and then we'll just see that final education verification form. So our idea is to have this drafted by our next RCAC meeting, which we may end up having another one before the December meeting. So if that does happen, we'll try and squeeze that into that meeting just so you all have a chance to see the draft. And then I would love to hear any feedback from all of you if you have any ideas or on the education verification form as well. Did anyone have a chance to look over the form we provided?
I like the new form. I don't have any recommendations for changing on the updated verification of education form.
Sandra, thank you for your help with that.
So yeah, we will be presenting that form. I'll be working primarily off of Sandra's recommendations, just to try and get something that's a lot easier on the eyes and easier for the students and employers to deal with. So outside of that, we do have a public hearing coming up. This is for a ethics course for RCPs. There's going to be a public hearing on September 24th at 1:30, and it's going to be virtual. I did send you the rules in your meeting materials. Basically, it's just defining the criteria for ethics courses. If you have any interest in viewing that or would like to provide written or verbal testimony, let me know and I can send you a link to register for the hearing. And any comments will need to be made before September 24th.
Thank you, Sierra. One new thing, because we were looking at our annual report that's on our website, and we were looking at it, we saw different maps that were on there that showed, and they call them heat maps, that showed the different occupations and how many different licensees there are for each occupation across Ohio. And so that was something that we thought we would start to share with you that is specific to the respiratory therapist, care therapist. And that was also in the information that was given to you guys. And part of what I see that we showed is the RCP licenses per county that were issued in, I think, 18, 19, and 20. And then we showed a graph that showed the RCP licenses over a year and at what times they peak, which I think might be really helpful. And so this is something that we wanted to start doing, to start bringing more license-specific information to you. And once you've looked at that, if you have any questions or concerns, or if that's something that is helpful or not helpful, or you need something that's more in depth, we know going forward what's helpful for you to know about the occupation. And if you need copies of any of this or any seen in any different ways, let us know, because we'd be happy to try to get that for you as well. Are there any comments or concerns on that? No. Sue is going to provide an update from the Ohio Society for Respiratory Care. And not only is she going to update us, she's also going to give us some information on the concept of an advanced practice respiratory therapist, and it's a new level. And I know that there's already some people at Ohio State that have enrolled in this program. So Sue, we're looking forward to hearing what you have to say about this today.
Well, thank you, Jill. I hope that you all can hear me. It's been a little choppy today, and I have quite a bit to try to discuss with you today. First of all, thank you for allowing me to address you from the OSRC today. Some of you who
You're kind of cutting in and out there. Can anyone hear her?
Sue, I think we can't hear you. If you can, I'm not sure what's going on with your microphone.
I'm wondering if she's not going to screen share, if we should have her call in maybe. Does she have the number to do that, Sierra, do you think?
Yeah, it's so let me just resend that. It's in the meeting join link. Okay, I just sent that over.
Okay. She must have gotten it because she signed off, so. The trials and tribulations of trying to live stream.
I know. I was just gonna say. I feel like we've had something like this happen every time. It's just the way things are now.
We just all take turns.
Yeah.
There we go.
Hello?
Hi, we got you back.
Hello? Okay, great. Thanks so much, Jill. Thank you. Thank you again for allowing me to address the RCAC today. I think for all of us in the profession of respiratory care, and also our affiliated physicians who work with us every day. I wanted to start by saying at the first RCAC meeting back in May of 2018, members of this council spoke with A.J. Grober, who was the executive director of the state medical board at that time, about goals for the RCAC. And one of the members mentioned that it was important to advance the profession of respiratory care in Ohio, and talked about a future goal of possibly licensing advanced practice respiratory therapists in the future. So just as a background, the OSRC, the Ohio Society for Respiratory Care, took up this cause in its 2019 strategic goals. And so I'm here today to update you on those efforts. Just to start out, we're not asking for any action from the Respiratory Care Advisory Council or the State Medical Board. We're only trying to be transparent with the OSRC's effort. What I would like to have you do is, I know that Sierra sent out a PDF that had several handouts for the talk today, and we're going to follow the one OSRC handout that has the logo on it, that has on the top an introduction to the concept of advanced practice respiratory therapists for our discussion today. So if you have that available, you can follow along. If not, I will try to keep to that handout. So our purpose today is to introduce and define the concept of the advanced practice respiratory therapist, to review the progress that's been made both nationally and locally to advance the practice of respiratory care, to specifically discuss Ohio State University's master's program for advanced practice respiratory therapy, which includes its curriculum and it's also clinical education. And fourth thing, to educate and to evoke dialogue concerning the APRT, its values, and its role with all stakeholders. So far, since fall of 2019, we've held 4 separate statewide forums, and ending this last one in the end of August. I'm going to try to give you the highlights of all these presentations in less than 30 minutes. So please recognize that some of the details will be in the handouts that you've been sent. So let's start off and just talk about what is an advanced practice respiratory therapist. It's truly a new profession. It's a non-physician advanced practice provider, similar to what an advanced practice nurse or a physician assistant would be. It offers a clinical ladder for respiratory therapists. It requires a master's, at least, or possibly a doctorate degree. It builds on a bachelor's in respiratory care to create an advanced practice provider who's uniquely prepared to care for cardiopulmonary patients in the same way that an advanced practice nurse builds those skills on her bachelor's of nursing degree. It provides provider services under the supervising licensed physician, and its scope of practice is determined by the supervising physician, but it's related to the care of patients with cardiovascular or cardiopulmonary conditions. So an advanced practice provider as an advanced practice respiratory therapist would kind of fill a niche role as opposed to a general role of the advanced practice nurse or the physician assistant. So let's talk just a little bit about what's been happening. If you look at the American Association for Respiratory Care, which is our national organization, national advanced practice respiratory therapist efforts began in 2007-2008 when the American Association for Respiratory Care announced its vision for the future of respiratory care, which included our need to be more involved in disease management. Since that time, and actually very recently, the AARC has published 2 documents to show the gap in current cardiopulmonary care and also the need for a non-physician advanced practice provider with cardiopulmonary skills to help physicians who are trained to work with cardiopulmonary disease patients. So there's 2 percent, and it is an article out of Chest, and that article is entitled Adequacy of Provider Workforce for Persons with Cardiopulmonary Disease. If you can access that or you want to look at it as I review this, we're going to turn to the very last page, which basically is the conclusion. And the study that was, again, published in Chest, and that was in May of 2020, demonstrated that gaps between the availability of providers and the needs of persons with cardiopulmonary disease exist across all clinical settings. It is alarming that these gaps span major healthcare settings, which include ambulatory, critical care, and post-acute care, as well as several cardiopulmonary specialty areas. A frequently cited solution in the literature was to use advanced practice providers to fill these gaps. However, currently available advanced practice providers often lack the specialty cardiopulmonary training and usually provided care and education to lower acuity patients. Improving the preparatory training of current advanced practice providers or expanding the advanced practice provider role to specifically trained advanced practice providers with cardiopulmonary expertise are options that alleviate the identified workforce. Importantly, reducing the administrative burden by using specifically trained providers is another approach that could lessen the current gap in cardiopulmonary providers. So that was from Chest, and that has sort of demonstrated that there's a gap in being able to provide care to all patients with cardiopulmonary disease. The second article was just recently published June the 30th in Respiratory Care, and that was the last article that was sent to you just this morning, and that is physician support for non-physician advanced practice providers for persons with cardiopulmonary disease. This was a third-party survey of 1,400 physicians who have been trained to work in cardiopulmonary disease. Specifically, they interviewed sleep specialists, pulmonologists, critical care physicians, allergy and immunology physicians, pediatricians, and anesthesiologists. If you have that article in front of you, if you turn to page 6 talks about the responses of these specialties in terms of whether they agree or disagree that there is a need for a non-physician advanced practice provider with cardiopulmonary disease expertise. I'm going to read this to you because I don't know that everyone has it, and I apologize that I'm on the phone. I can't see people's faces. But basically, sleep specialists agreed currently there is a need, with 91.5%, pulmonologists 75%, critical care 71%, allergy and immunology 63%, pediatricians 61%, and anesthesia at 53.5%. In terms of future need, all of these numbers essentially went up a little bit. With sleep, sleep was stayed the same at 91. Pulmonary went up to 83.5. Critical care at 77%. Allergy 71%. Pediatricians at 69.5%. And anesthesiologists at 59%. Again, the results of this particular survey suggest that there is a majority of specialists out there that care for cardiopulmonary patients that do have an interest in an advanced practice provider with cardiopulmonary disease expertise. Then they looked at the need currently and future in relation to inpatient or outpatient or both. And most of those were interested at about a 70% for current and about more than 70% at 72 to 77% for future need. So again, this is all in the article that I sent you, so you can verify that. I'm not trying to belabor this. Also, another point was, well, even if you believe that there's a need for this, would you be interested in hiring such an advanced practice provider? And if you look on page 7, there's a table 8 that looks at very interested, somewhat interested, and it looks as if, the majority were interested if you combine very interested and somewhat interested. And this was even asked in the survey if at the current time, respiratory therapists or advanced practice respiratory therapists or that provider would not necessarily be able to bill for their own direct services. So that's an issue that obviously the American Association for Respiratory Care is addressing at the CMS level. But the overwhelming majority do and were interested in hiring such an advanced practice provider. So both of those articles have given, obviously, our profession the impetus to move forward. The AARC has also developed a definition for the advanced practice respiratory therapist and a scope, which you will see in the legislative language that we have proposed at the end of this discussion. So the AARC is one branch that is our professional organization. The Commission for the Accreditation of Respiratory Care is the agency that oversees accreditation of our educational programs, and that term is COARC. And COARC has developed program accreditation standards that they introduced in 2016. You also have a handout that was at the end of that PDF. That was the COARC standards. It's a brief discussion of the core competencies that would be expected from an advanced practice master's degree program. The full document of expectations, which is more than 100 pages if you want to print it out, is available on the COARC website. I want to say that these competencies and standards were developed with significant physician input on expected competencies to work in the inpatient environment, in the intensive care environment, with mechanical ventilation, et cetera, as well as the pulmonary environment, outpatient pulmonary, and sleep. And all of these standards have been endorsed by the American College of Chest Physicians, the American Thoracic Society, and also the American Society of Anesthesiologists. Those are the triad of physicians that have always been a part of the COARC organization. The third group that credentials respiratory therapists is the National Board for Respiratory Care. And it is also committed to developing the APRT competency certification and credentialing exam, and has trademarked the use of the credential either RRT-APRT or APRT-RRT. So all three groups have been working, like I said, since probably, 2008-ish on their responsibilities in moving this APRT effort forward. So why is Ohio involved? Well, we've always kind of been first to do a lot of things. But more importantly, the Ohio State University Respiratory Therapy Advisory Committee that oversees Ohio State's bachelor's program and master's programs had talked for years about the frustration that they saw with the number of grads and then eventually some of the managers who were on that advisory committee seeing their employees leave the profession to pursue advanced practice outside of respiratory care, which would be going back to become a nurse, to be an advanced practice nurse, or to become a CRNA, or to go and use their bachelor's in respiratory care at Ohio State, which was, a pre-med type bachelor's, and go on to become a PA. So their advisory committee suggested that they look into the need and then eventually possibly developing a program for advanced practice in Ohio. And so they did a survey in 2012 that showed some widespread need for an advanced practice respiratory practitioner in Ohio. There is another handout that I had in that packet that is a publication that was in Respiratory Care Education Annual. So this would be the fourth one that we're talking about right now. This was published by a couple of different, well, actually almost everybody at Ohio State at that time in 2014. And with this information, they got the okay again from their advisory committee to go ahead and pursue a master's, essentially APRT curriculum with, as long as they could get physician support for the training and the education, the clinical education of these potential students. So the program received university approval, the Department of Education approval, and eventually in 2019, after they got all of their documentation together, they received COARC accreditation in 2019. This is the first APRT program in the country. It has the capacity for 15 students a year because it has intense, clinical training that must go along with the curriculum. And they have taken actually 7 students into their program in the first class that started January of 2020. Graduation for these students is expected in 2021. There is a handout that I would like to discuss a little bit more in detail with you, and that is the OSU curriculum that's in your handout. It's just 2 pages. The front of it has the Ohio State University Masters of Respiratory Therapy a description, a word description of the program overview, the curriculum, and also, obviously, they have their expenses because the fewer student, you'd want to know that. But basically, the second page is their curriculum. And they have a very robust curriculum. They have collaborated with the doctoral programs in their College of Health Sciences there, and also with their advanced practice nursing program. If you have an option to look at this as I'm speaking with you, the first class they have to take is evidence-based practice, critical analysis of measurement and diagnostic tests. And the second semester they take evidence-based practice 2, critical analysis of intervention research, and systematic review. Both of those courses are expected for anyone in a graduate, master's level, or doctoral level, such as the PhD in occupational therapy and physical therapy. So the students in the respiratory APRT program are taking the same level of evidence-based practice, critical thinking, and including diagnostic tests, as well as research and systematic review of the literature. Second, they also are taking 3 of the same exact required courses that the advanced practice nurses take to qualify for their advanced practice credentials, that are required for them to practice. And this is the pathophysiology of altered health states, advanced health assessment, and advanced pharmacology in nursing practice, the same course that's required for them to have prescriptive power, assuming passing their exam and having that within their physician agreement. And then they have very robust respiratory programs with all of the clinical education provided by physicians. Now, because this is the first program, we're not highlighting it to try to emphasize Ohio State. It's just they are the only program right now. And all of their clinical education is occurring with physicians, faculty at OSU Wexner Medical Center and also Nationwide Children's Hospital. There is an option for the advanced practice respiratory therapist in the Ohio State program to choose an adult track or a pediatric track. Those are the only 2 sort of specialty or selections that are allowed. So I would have you just look at this and just recognize it's as robust as the advanced practice nurses take. And they have been nothing but wonderful in helping Ohio State with their program and working collaboratively there. So that's what Ohio State has done. So if we move a little further here, the OSRC really was the first state to require associate degree for respiratory therapists in 1997, which made all respiratory therapists then registry eligible. In terms of registry, which is the RRT credential, which assesses your ability to essentially assess and make decisions to implement protocol-based care, we were the first state in the country for licensure in 2015. When we did that, we had all kinds of stakeholders at the table, and we had no real opposition. We had the Ohio Hospital Association there when we made those decisions. We had a number of other organizations to make sure everyone understood why we were moving in that direction. So when we began the process to license advanced practice respiratory care in Ohio in 2019, we understood we would be the first to license them. And we understood also that it would require a law change, which is not easy, and we understand that. The first thing we did was met with the state medical board staff in July of 2019 to let them know of this upcoming effort. When I say staff, we met with Nate Smith and Jonathan LaCrosse at that time. both of which are not assigned to this RCAC any longer. But we did want them to know, we wanted them to filter up to leadership there so that they wouldn't be caught off guard if they heard about it. We also then announced educational forums in the fall of 2019 at our state meeting in August of 2019. These forums have a goal to educate all stakeholders. We started with our own RCPs and we asked them to bring affiliated physicians with them when we met in 6 regional forums across the state, November through January. Once we were sure that our managers understood what the role would be, because some people actually thought that these advanced practice respiratory therapists would be a part of the respiratory department, and that's really not the intent. The intent is for them to be a non-physician advanced practice provider working in a physician group or a network of some sort. So after they understood, we then opened up our forums to be sort of a collaborative, multidisciplinary stakeholder forum. And so the intent here was to evoke comments. So as we moved forward, we would know, how to develop our draft language. So also in the meantime, we did meet with the new staff. So Jill and Sierra and Chelsea are aware of our effort, and we asked them to also inform Stephanie Loca, who's our new executive director at the State Medical Board. So June, July, and August, we held 3 of these collaborative stakeholder virtual meetings. By then, everything's virtual. And we, again, discuss kind of the background on national and state efforts. We also had national speakers come in and confirm some of these surveys and some of the publications, and let COARC talk about what it had done and what the MBRC planned to do. And we also, every time, tried to elicit comments from the people attending our sessions. The people who attended included AARC and OSRC leadership. We did have Karen May and Rob Pelfrey from the RCAC. We did have staff from the State Medical Board. We had directors and managers of respiratory care. We did have physicians, pulmonologists, critical care, cardiologists, pediatric and neonatal subspecialists who had contacted their respiratory directors and asked that they be involved. We had medical directors of respiratory care. We had the Ohio Organization of Nursing Leadership, OHA, the Ohio Nursing Board, the Ohio Association of Physician Assistants, the Ohio Society for Anesthesia, the Ohio Association for Advanced Practice Nurses, OSMA, OTS, and more. We generally had anywhere between 46 and 69 attendants at each of our sessions. So our last session was over August the 25th. And at that meeting, we shared with everyone there the language that we had developed and sent to LSC, which is Legislative Services Commission, who take that language and with a sponsor saying it's okay to move forward, we had someone that sponsored the LSC draft. And so we have an official draft of the language, and we do intend to seek an actual legislative sponsor soon. And I attached in your PDF a handout of key sections of that draft for you to look at. And we are kind of at a point where we're on the 3rd draft to send back to LSC, because every time we think we know what we want to say, we find out it's said sometimes differently when it comes back in legalese. So I don't know if you have that in front of you. It is a document that is a select sections from the 3rd draft of language. Basically, we took the respiratory care law and added the advanced practice respiratory therapist definitions to it, qualifications, and then also I added here prohibitions, which probably wasn't the best way to describe what I wanted to describe to you. Probably licensed to practice as an advanced practice respiratory therapist is a better section. But I don't want to continue to take over the meeting, but I think we've accomplished a lot here. The advanced practice, if you look at definition, means an individual who holds a current valid license issued under this chapter that authorizes the practice of respiratory care as an advanced practice respiratory therapist. J, the practice of respiratory care as an advanced practice respiratory therapist means providing to individuals and groups care that requires knowledge and skill obtained from an advanced formal education, training, and clinical experience. Such care includes performance of services delegated by a supervising physician in the diagnosis and treatment of patients with cardiopulmonary disease or conditions, including prescribing, ordering, procuring, personally furnishing, and administering drugs and medical devices. Second section that I pulled out is the qualifications, okay? They're good moral character. They have to have an active license to practice respiratory care as an RCP in the state of Ohio. That's B. C, that they've successfully completed the requirements of master's or doctoral educational program approved by the board that includes instruction in pathophysiology, symptomatology, differential diagnosis, disease management, including the use and prescription of pharmacologic and non-pharmacologic interventions, health promotion, and disease prevention of cardiovascular and cardiopulmonary disease. And that the individual has passed an examination approved under rules adopted by the board that test knowledge of biomedical and clinical sciences related to advanced respiratory therapy, theory and practice, professional skills and assessment, management and follow-up for cardiovascular and cardiopulmonary disease, and other such subjects as the board considers in determining fitness to practice. I'm going to read you a not prohibitive acts. I'm going to read you one more section, and this is all that I have formally to present. And that is a license to practice as advanced practice respiratory therapist issued under this chapter authorizes the holder to practice as an advanced therapist as follows. The advanced practice respiratory therapist shall practice only under the supervision, control, and direction of a physician with whom the advanced practice respiratory therapist has entered into a supervision agreement under 4730. I'm sorry, I don't have the exact code there. The advanced practice respiratory therapist shall practice in accordance with the supervision agreement entered into with a physician who is responsible for supervising the advanced practice respiratory therapist, including, if applicable, the policies of the health facility in which the advanced practice therapist is practicing. And the state board may adopt rules designating facilities to be included in healthcare facilities in addition to the facilities that are defined in this. So basically, we took the physician assistant language and used it as a model for the way that our law is tailored to meet the physician supervision, prescriptive authority, and prescriptive requirements, and pretty much anything else that is specific to the management of patients with cardiopulmonary and cardiovascular disease. So the language that we've put together as we get a legislative sponsor will become public. We don't have the current draft public yet because we don't feel that that's appropriate until we ask permission from the legislative sponsor. So I'm sorry that took quite a while, but that was about 4.5 hours worth quickly. So I don't know, Jill, if you want to open it to questions. I don't know how much time people want to continue. Thank you.
First of all, Sue, thank you so much for making sure that the medical board was one of the stakeholders that you've kept informed about this as you've moved along. I think it really makes a huge difference. And I think this is important enough that we'll take as many questions as you're willing to answer. So anyone that has any questions, please go ahead.
Well, first of all, if I may, I just want to thank Sue and everyone that has been so proactive and has put in countless hours in getting this to where it is today. I think from a recruiting standpoint, we all know that we're experiencing a severe shortage of respiratory therapists or even students interested in becoming respiratory therapists. So from a recruitment perspective, a few questions that were new this year for me were what are the prospects of advancement in the field? And this creates potentially us being able to say, if at some point you want to advance in this field, here are the options, as opposed to nursing, for example, that, going into nursing, you do have the options of down the road advancing the profession to a nurse practitioner. So I think that is just so exciting, and being able to even get individuals interested in becoming respiratory therapists. And also considering the current shortage that we're experiencing both in Ohio as well as nationally, keeping RTs within the RT field is, I think, very, very important. So I, for one, am extremely excited to hear about all this, and look forward to seeing where this goes and how quickly it gets implemented.
Thank you, Sonia.
Dr. Coccarello?
Yeah, hi. Sue, thanks for updating us and giving us all this information. I had two quick questions. Well, what I presume are going to be quick questions, and one maybe a little more involved. So the Ohio State students, I think you said there were 7 that are currently, they graduate, assuming they do all their coursework and everything, they graduate at the end of 2021?
Yes, I believe it's the end because they started in January.
All right, so it's a 24-month.
Right.
Roughly 24-month program. Okay. And then is Ohio State the only one, I presume it's only one in Ohio, is it the only one in the nation right now that has already started the master's program?
Yes, it is. It is truly, there are many master's programs across the U.S., but this is the only master's with the curriculum that's very specific to advanced practice respiratory therapists. The other masters would be more related to the science or teaching or research, but this is very specific to being an advanced practice provider.
I see. Thank you. And then go ahead. I'm sorry.
No, I was just going to say there are 5 programs currently in the state of Ohio that produce bachelor's prepared graduates. So my assumption is that others will potentially get on board if there is a licensing that will allow their graduates to find work as an advanced practice provider. That's all. Sure.
And then the only thing that, when I reviewed all the materials, the only thing that really jumped out at me in the OSRC update materials, it's that 27-page document that we got via email. It's the second to last page. It's always the second to last page that your eye gets on. But it's the COARC statement, the Commission on Accreditation for Respiratory Care. So it was the entry, it's under number 1 on the 26th page, the second to last page. It said entry into respiratory professional practice master's degree program. So it stated, and I'll just quote it, a program that offers individuals who have baccalaureate degrees in disciplines other than respiratory therapy the opportunity to enroll in a respiratory care program offering graduate credit and so on and so forth. So the way that reads, and I understand that's not from OSRC necessarily, but the way that reads, it sounds like someone could be in an unrelated field, and as long as they're a good enough student, they can get into the master's program, but not necessarily have a background in respiratory therapy. I think that's not likely or common, but I just want to be careful about what we use, because it's a little too vague, I think, the way they've stated it.
I'm sorry, what page did you say that was on? I was trying to
Sure.
follow you here. Second to last page, you said?
It's the second to last page. So it's the logo of the COARC, the Commission on Accreditation for Respiratory Care. So it's of the 27 pages, it's page 26. So it has
Okay.
that, and then it says introduction in a box, and then below that it's the bullet point. Well, it's number 1, and it's bold-faced. Entry into Respiratory Care Professional Practice Master's Degree Program. So I'm just quoting what is written. So, and you said, in terms of Ohio, this is somebody who's already been licensed to be a respiratory care practitioner. So I think at least that obviously is.
Well, let me get back to you on that. But my understanding is, and I apologize, but I can't find it in my combination of things here. The undergrad you have to have a bachelor's in respiratory care that's from a program that is COARC accredited for that. And the only thing that I can tell you is that some people go through and do a full, like a pre-med type bachelor's in respiratory care. Others do an associate and then do a completion program, but it also has to have the same qualifications. So I'm not quite sure what, I will look at the handout that Sierra sent out and see if I can cross it. And then I will send you an email from people that are much better in tune with the educational side of things. But my understanding is that no, you would have to have a bachelor's in respiratory care, whether you did it all at once or you did it as a completion program with the same requirements in terms of the sciences that would allow you to take those classes that are those critical thinking, evidence-based practice, classes. So, but yeah, I did not see that, so I'll have to look at that for you. But I will respond to you.
I highlighted it and I'm emailing it to you as we were talking. So that way.
Okay, great. Thanks. Perfect.
Still in the 27 pages, but look at page 26, and I highlighted the passage, so it's sent to you.
Okay, thank you very much. I will look at that and let's see here.
If you get the response back to me, it's Jill. I'd be happy to send it to the whole council.
That would be
great. Thank you. I will. Thank you so much. No, I appreciate that comment too, because the intent is for us to build on the expertise we have as therapists, working in those environments. So, yeah.
And if I can just jump in very quickly, just because of participating in some of the meetings that we've had on HRT, that statement, and I agree with you, Dr. Coccarelli, it seemed there is a little bit of vagueness there, but it is designed for example, individuals that if they didn't graduate from, I'll just say from Kettering College of Medical Arts, which has a respiratory care baccalaureate degree, if they graduated from Sinclair, then they obtained a baccalaureate degree that was in health sciences, not specific to respiratory care, that they would still be eligible to apply to this master's program as long as they were a licensed respiratory care professional with an RRT credential. So I remember that's exactly what that's worded for, but I agree the wording is a little vague.
Yeah, I think we just need to have a footnote or an addendum or clearer language saying this is someone who still has a healthcare background, is licensed respiratory care professional. So it's very clear to everyone, especially when we get into things that the state medical board may be asked to kind of give their stamp of approval to. We just want to be as specific as possible. So if we added language like that, I think everyone would be very comfortable with it. I certainly would.
No, and I know that's the intent. So, okay, well, I will have someone of higher education qualification. And I think, Sonia, you did it there. So, but I just think that, that's what it truly means. It does not mean someone without a bachelor's with enough respiratory science. So, okay. Thank you for bringing that to my attention.
No, thanks for the clarification. So thanks to both of you.
Hi, Sue. Robert over here.
Yeah.
I'm a huge advocate of PRT. My question is, have we had any conversation with the NBRC as in they're going to administer the...
Yeah, I'll tell you what, we have been talking with them and the AARC, and it's kind of a technicality in terms of them developing a credentialing exam, because there's no one in the profession currently functioning in that role. A credentialing exam may take a little bit of time, but a competency certification is likely something that could be done quickly and be available hopefully within the time period between now and the time that licensing occurs. So there's, it's kind of the chicken or the egg kind of thing. So we're just trying to get them, and they are truly committed to getting us a national exam. But what it's called and how it will be maintained, as a certification or whatever, we need some dialogue with that. We don't know the details of that yet.
Any other questions?
Thanks for asking.
Comments? Sue, our next meeting is not until December. And I think all of us, especially, the medical board, and making sure that we get a bill draft and get it through to our legal people, just to make sure that for your sake and our sake, that all the I's are crossed, or all the I's are dotted and T's are crossed. Do you know when we would be able to have a copy of the bill for us to take a look at?
Here's what I'm going to tell you. This afternoon, we have a conference call at 4. It will be the final sign off on the last draft that we think meets at least our expectations. We will then be probably going to a legislative sponsor. And once that happens, if we get permission to share, we will be allowed to share. So, but we don't feel like we should share something before we ask permission of the sponsor. So I'm assuming soon, because it's better for us to share early and get input, or then go through a number of amendments. So that's the plan. So, and I appreciate you letting us bring this discussion. I wish there was a way for us to connect with every therapist and every physician in Ohio, before now. But some of it was, by word of mouth. And so we hope. We've had good support from some of the physicians. We've had very good support from physicians all over the state who did come to the conferences primarily because they were interested in seeing it move forward. But if there's any questions, you're all welcome to email me, and I will get the experts to make sure and get you the right answers. My role has been more of an operations one in trying to facilitate the dialogue, and but the faculty at Ohio State know quite a bit more than I do as far as the details. So, but thank you all for listening, and I hope at least the concept you find positive. And our goal is to work together, obviously, with the medical board, since we are licensed under you, and this would become a medical board responsibility. We know, it may not be a short haul, it may take some time, but we do appreciate the willingness of you to let us present it here today. So thank you very much for all of you for listening.
Thank you. Do we have any other comments or questions around anything we've discussed during this meeting? Then could I get a motion to adjourn?
Oh, Jill, I think we've received that last minute rule from DODD.
Oh, yeah, we did.
So I think with that, we're going to send that out individually to each of you for comment. And I think we were possibly going to do an ad hoc meeting in the near future to discuss that rule.
Yeah, we received a rule late Friday from the Department of Disabilities, Developmental Disabilities. So we'll be sending that out to each one of you individually for you to comment on if you have any comments. And if we need to, then we'll get back together in the meantime. We'll try not to waste your time, but if it's something that we need to do, then we'll make sure that we get a hold of you and try to get it done before the end of the year. Could I get a motion to adjourn if no one has anything else?
So moved.
Thank you, Dr. Pepperell. Could I get a second?
I'll second.
Thank you. Thank you all for attending. I appreciate it.
Thanks, everybody. Have a great day.
All right, thank you.